Good afternoon. It's March 18th. I'm Gary Pace, the Public Health Officer for Lake County, and we're here to give you the coronavirus response update for Lake County. So right now, the case rate continues to drop. We're continuing to roll out the vaccines as quickly as possible, and we have just moved into the red tier as of March 17th for the first time since last fall. So we're very excited about that. We'll have Sarah give you the data, and then I'll give some more detail on some of this. Sarah?
Good afternoon, everyone. I'm going to briefly provide an update on trends at the state level and what we're seeing in Lake County. We continue to see a declining test positivity rate shown here by the graph on the right. So statewide, the 7-day average is 2%. Testing does continue to decline statewide. You can see that here on the left. This gray line represents a 7-day average. So testing continues to decline statewide, but so does the testing positivity rate. About 3,000 new cases were reported yesterday for over 3.5 million cases since the beginning of the pandemic. The daily case rate continues to decline, though not as rapidly as it was in the beginning of the month. So most recently, the statewide daily case rate was 5.9 cases per 100,000. And in the state of California, since the beginning of the pandemic, 55,795 people have died from COVID. Here we're looking at the number of cases by week in Lake County. So Dr. Pace mentioned that Lake County moved into the red tier on Wednesday. That's based off of two metrics from the week of February 28th to March 6th that we have here in red. We had 2 weeks of better metrics, which moved us into the red tier under the new thresholds set by the state now that the state has reached its goal of administering 2 million doses in communities with some of the least healthy community conditions. But back here in Lake County, we continue to identify fewer cases each week. And we did identify one death in the last 7 days. For this week, the week of March 7th, we've identified 33 cases thus far. We'll continue to identify more cases, but what this means is that we expect to have our metrics for this week to keep us in the red tier. And here are the official metrics for the week of for February 28th to March 6th. We had a daily case rate of 5 per 100,000 and a testing positivity of about 3%. The map shows you that most counties are now in the red tier, which indicates substantial transmission, and about 88% of the population living in California is living in a red tier county. And then here I just wanted to briefly show the new threshold set by the state as they've reached the goal of administering 2 million people in communities with the least healthy community conditions. So to stay in that red tier, we need to have 4 to 10 daily, a daily case rate of 4 to 10 per 100,000. So in Lake County, that means we can't have more than 45 new cases in a week. Otherwise, we would risk going into the purple tier. So just wanted to show this to indicate that these are some of the numbers that we're watching, that we expect to stay in the red tier for the next couple of weeks. When the state has set another goal of administering vaccine to 4 million people, and these lowest, what is called the lowest HPI quartile or healthy places index, when that happens, there'll be another change in thresholds with the daily case rate because more people will be vaccinated and thus protected. And so it's a loosening of the daily case rate essentially so we can open our communities more broadly. And then my last slide here is on the vaccination progress in Lake County. So this first sort of set of rows here, we're looking at data from the California immunization registry, which are reported by the state at covid19.ca.gov. And in Lake County, we have about 6,600 people who are partially vaccinated, and that's about 13% or 12.6% of the population 16 years of age or older. And then we've got another almost 6,800 people who are fully vaccinated, and this is about 12.8% of the population. So about 25% of the population has had at least one dose in Lake County of people 16 years of age or older. The data below I wanted to bring forward because the state system doesn't include data from administered through tribal health, and tribal health has been working on the vaccination effort in Lake County and represents a sizable number of people. So we wanted to include this information so that we can better understand vaccination coverage among the entire population. So when we include the data from tribal health, which is a different data system, but tracks the data in the same way, we see that about 14.3% of the population is partially vaccinated and about 14.2% is fully vaccinated, for a total of almost 29% of the population 16 years of age or older. So we'll continue to track both these metrics, but wanted to explain why that this first set of data don't include the data for tribal health. And so we look at the combined data to better understand vaccination coverage in the county. Thank you.
Thank you, Sarah. And so as of yesterday, we were officially into the red tier in Lake County. And this allows us to open up indoor dining now, up to 25% capacity of the restaurants. Gyms, dance studios, yoga studios can open up to 10%. And it also allows the middle schools and the high schools to be able to open back up and have on-site learning. So my understanding is the high schools and the middle schools are planning to start a hybrid form starting on next Monday. So that should be getting some of those kids back into the schools now. So to get to the orange tier, we'll have to be in the red tier for a minimum of 3 weeks. And then the last 2 weeks have to be in orange tier data. We're not in that level yet with the current data, but if we do, as Sarah was mentioning, if we do get to the 4 million vaccine doses in the lowest quartile around the state, they're going to shift the restrictions. And then at that point, with the current data that we have, we would qualify for the orange tier. Now, we will have to be in it for a minimum of 3 weeks before we can move to orange. So we're looking probably about a month away before we can get to the orange tier. But if we continue the way we're going now, I'm optimistic we should be there within a month or so. So I want to talk about the vaccines today. We are continuing to roll out the vaccines, as you can see from the data that Sarah shared. The inventory looks like it's going to stay at least about the same. We're getting about the same supply, 2,000 to 3,000 a week now for the next couple of weeks. And then after that, we expect it to expand quite a bit, maybe 2 to 3 times as much. We have the sites that are still working well. We're going to make some shifts. The site in Lakeport is going to shift to just being on Mondays only. And if we have more demand than just the one day, we can expand the hours or expand the staffing so that we can get more people in there. The Clear Lake site is going to move from Thursdays and Fridays, which is will continue through this week, but starting next week, it's going to go to Tuesday, Wednesdays, and Thursdays in Clear Lake. No Friday clinics, no Saturday clinics. This is because there's a certain cap on how many people we can run through that site during the day. We're also having some issues with some of the fishermen coming in on Fridays and wanting to use the ramp and everything. And so it just seemed like it was going to be better to move to some other days during the week and expand the days, because we really can't get more people through there on any given day. It's not as big a space as the one in Lakeport. For the qualifications for who's eligible for the vaccine changed a little bit this week. So as of a couple days ago, people with chronic medical illnesses age 16 to 64 are able to get vaccinated. there's a listing of the different conditions that qualify people, and you can go look on the website for that. But and we're not requiring notes now from people's medical providers. All people have to do is just self-certify that they qualify according to the criteria that's listed. So we'll have you sign a piece of paper. If you do have your doctor's note, that's fine. You can go ahead and bring it, and that'll help. But if you don't have to go ahead and call their office to get it. All you have to do is come in, and if you qualify under the criteria, you just have to sign something, and we'll have you come on through. Appointments are continuing to get filled up, and so for the rest of this week, we're doing it with the old system where you go on to the health department website and click on the link and go ahead and sign on for the appointment. Starting next week, we're going to the state's new software platform, which is called My Turn. And so if you want to get an appointment for Monday or Tuesday, Wednesday, Thursday next week in Clear Lake, you just go ahead and go to our website and you'll find the My Turn connection. You go on that site, click it, and the links should be open by now. And so we're going to start trying to fill up those slots for next week. It's a whole new system for us, so there's bound to be some bumps in the road, so be patient. But if you're not able to get in, call and let us know. They do have a phone line as well, so if you don't have good internet access, or you don't like to do it on the computer, or you're Spanish speaking, you can call this number, and you have to kind of work your way through, and they should be able to help you. If that doesn't work, call us and let us know, and we'll keep working with you and trying to figure out how to get you in. If you're needing second appointments, go on our website again and click on the link and get through there. We're committed to getting people their second doses, so don't get nervous. When the time comes due, just get on and get on a link and get an appointment and come in. If you're not able to do it, if you're having challenges with that, contact us at the Mohawk email or phone line, and we'll get back to you and try to figure out what you need. The ethics committee is continuing to meet weekly at this point, and so if anybody out there has some concerns about why they're not qualified, when they're going to be in line, you can go ahead and send an email to our Mohawk line, and we'll get it to the ethics group to kind of talk about it. But at this point, we're pretty much just following what the state says to do and going along with that. But if you have a specific question, they will talk about it and see what needs to happen. So the last thing I really want to talk about today is just how well these vaccines are working. We've had very few problems with any kind of side effects. I mean, certainly some people have some aches and pains and fevers that may occur for a day or two afterwards, but we've not had any bad side effects in our county, and we're now getting up to 30% of people having at least one dose. So this is getting really good. And I think there's a couple things I just want to encourage people that are holding back and waiting to see how other people do. I really want you to try to think about getting this vaccine as soon as you're eligible, because the sooner we get a critical mass of people vaccinated in the community, the sooner things are going to be getting back to normal. We are just seeing very good results with this, and people are able to socialize more. There's getting to be more and more guidelines from the Center for Disease Control about people in the workplace, or people being able to gather, or people in the nursing homes that are vaccinated. Once people are vaccinated, it does not seem like we're seeing a lot of problems with them getting infected with the variants or anything right now. There was concern about that originally, but we're just not seeing that very much at this point. So the sooner people get vaccinated, the sooner you're going to be able to go visit with your friends and hang out with them in a way and that's safe. And the sooner we're going to be able to come back more into a more normal lifestyle. And I think probably really mid-summer, we're looking at things getting just a whole lot better if we can get vaccinated. For the people that choose not to get vaccinated, I mean, that's a choice for sure. And but I think you're going to find that you're going to have more limitations in what you're able to do, because certain places are going to probably end up requiring vaccines to end up like traveling or going into certain kinds of places. So I think the sooner everybody gets vaccinated, the better it's going to be for all of us. But overall, we're seeing just really good things happen, and we're starting to open everything back up a little bit. And I think within another month, we'll be able to relax more. I think the state is going to be coming out with a lot of guidelines about outdoor activities and gatherings that we can have that are going to be much more flexible and open than it was last summer. It's been a year now. It was a year ago yesterday, really, that we really started closing things down. And it's been a long, hard year, and a lot of people have really, really suffered a lot during this time. And I just want to acknowledge that and just say, I think we're through it now, and it's looks like it's going to be getting better here in the coming months. And thank goodness for that. So, okay, thank you for your patience and your cooperation with everything.